Bismillahirrahmanirrahim. Today we'll start our lecture about nutrition and sensory processing disorder. First, what is sensory processing disorder? This was previously termed sensory integration dysfunction, and this occurs when the brain has difficulty processing information through the senses. It's a spectrum, it affects one or more of the senses. It can affect up to 16% of school-age children in the United States. It was first identified by Jen Ayers. She's an occupational. The sensory system includes the smell sense, tasting, seeing, touching, hearing, proprioception, and vestibular or the sense of position. Sensory processing disorder is further classified into three big entities. The first is the sensory modulation disorder, sensory-based motor disorder, and the sensory discrimination disorder, in which individuals have difficulty in regulating their sensory input. So they're either over-responsive, they're under-responsive, or the seeking type. People with sensory over-responsibility, they have a very low threshold for sensation. They are over-responsive even to very low stimuli. So sometimes you find that these children may go into an outburst or a temper tantrum just because they feel something that is not this annoying, like a piece of clothing, socks, food on their fingertips, and sometimes some movement activities like swinging and riding in the car, or hearing some unexpected noises like bell ringing, toilet flushing. They may go into a severe temper tantrum just because they are exposed to such stimuli. Often children with sensory overresponsiveness seem to be excessively cautious. They become upset with changes in their routine and have difficulty with transition between activities. On the other hand, the underresponsivity is just the contrary. It's a subtype of sensory modulation disorder that is believed to result from an unusually high threshold for sensation. They need sustained, loud, bright, fast, and intense input to get the attention of them. Symptoms might include not responding when their name is called, for example. They have extreme preference for sedentary activities, and they fail to respond to pain. Although no two children with SPDs are the same, some are sensitive to things like a tag on a t-shirt, for example, or the sound of a vacuum cleaner, while others may be uncoordinated, hard to engage in play, or in constant motion. The last type of the sensory modulation subtype is the sensory seeker subtype. Those children continuously seek for sensory experiences. They have an excessive insatiable drive for sensory experiences. So we find those children, they like to climb unsafe heights. They sometimes try to experience non-edible items like eating part of the wall or dust from the ground. They touch people or food objects to the point of annoying others. Sometimes self-injurious behavior may be explained by this subtype. They try to even injure themselves just to experience how pain feels. The other type is called sensory motor disorder. This is a motor challenge with an underlying sensory basis. They have poor posture control. They have sometimes what we call dyspraxia, which is motor planning problems. They cannot do a motor act in a coordinated fashion. And the last type is called sensory discrimination disorder. They have difficulty filtering and interpreting sensory information. They have difficulty in comparing details and disregarding irrelevant information. For example, difficulty discriminating visual information may present with inability to distinguish between letters, making acquisition of reading skills a challenge. So why not that those patients whom we see with learning disorders and problems in reading. They may have a sensory discrimination disorder. So, as we see, sensory integration is a very complex process. It makes it possible for a person to receive, organize, and interpret the information he receives from the world. The collation of this sensory information efficiently enable humans to function smoothly in their daily life. So, for example, he can say if this soup is hot or cold, are my arms or legs going to bump into anything? Do I need to go to the bathroom right now? The exact cause is unknown. There are a lot of theories that say that maybe it's neurotransmitters, they play a role in sensory issues. Dopamine, norepinephrine, and serotonin affect the CNS and impact arousal, sleep, attention, and motivation. Other factors like a genetic basis, prematurity, birth trauma, and hospitalization. Heavy metals ingested during pregnancy. Studies by the Star Institute, which is an institute specialized for sensory processing disorder, they found that at least three-quarters of children with autistic spectrum disorders, they have significant symptoms of sensory processing disorder, but the reverse is not true. So we find that most children with SPDs do not have an autistic spectrum disorder. This figure may show what we're trying to say, that SPD is the broader picture, and autism spectrum disorder is a group or a subgroup of those children. SPD is typically common in those who have autism and attention deficit hyperactivity disorder. It may also occur in typically developing children, so it doesn't have to happen in autism only. So this is a poor boy who says, I have autism and sensory processing disorder. You'll find this boy have trouble focusing. He doesn't like his hair washed or combed. He doesn't like loud noises. He chews on everything. He doesn't like his teeth brushed. He's very picky in the way he eats. He has certain smells and textures that make him gag. He's unaware of normal touch and pain, and he doesn't like his fingers and his toenails cut. He doesn't like crowds. Strong smells make him sick, and his motor skills are off. Sometimes he appears like clumsy patient like those with developmental coordination disorder. SPD is not recognized by the American Academy of Pediatrics. A 2012 policy statement by the AEP discourages pediatricians from using SPD as a diagnosis because of insufficient evidence as an independent disorder. SPD as well is not recognized by psychiatrists as a diagnosis by itself, though they acknowledge that children do have problems based on over or under receptivity of their senses. Although sensory processing disorder is accepted in the diagnostic classification of mental health and developmental disorders of infancy and childhood, it is not recognized as a mental disorder in medical manuals such as the ICD-10 or the DSM-5, International Classification of Disorders, and the Diagnostic and Statistical Manual of Psychiatry. And in response, there were a lot of comments on the DSM-4 till 2017. This is a screenshot I took from one of the comments of the parents, that it is so devastating that SPD is not enrolled in those manuals because, of course, this puts them at risk of paying all the insurance and the costs of treating their children with that condition, just because it is not acknowledged in the DSM-5. And there was an application for sensory processing disorder that was signed by many people, calling, or they wanted to have the sensory processing disorder enlisted in the DSM-5. What is the relationship between eating and the children who have sensory? As we know, eating is the most complicated human behavior. It involves all areas of human development. It's a complex sensory experience. You smell the food, you see the food, you feel the food, and then you taste it. At the same time, while eating, you sometimes contribute to conversations and you use your hearing senses during meal time. You need to do appropriate motor planning to maintain your postural control and to manipulate in the manipulation of utensils while oral defensiveness starts even before their first spoon. They do not want the spoon. They're defending the spoon. They avoid placing toys in their mouth. They refuse bottles or the breast. And this results in subsequent poor weight gain in use of G tubes and long-term feeding problems if they go on. Kids with sensory integration issues, they have higher sensory and nutritional needs. They tend to be picky eaters due to oral defensiveness and hypersensitivity to smell, taste, and textures. And their nutritional status has to be. In children with SPD, some may be obese, underweight, or even normal weight, but all seem to suffer from nutritional deficiencies due to their limited food choices. Eating fewer than 10 foods and significantly struggling to try new foods is beyond picky eating. It's a concern that an eating disorder might be emerging, and it is similar to what we call the avoidant restrictive food intake disorder. They're trying to avoid the foods that might make them go into a tantrum. In a study of 91 children aged 4 to 9 years, mild to severe intellectual developmental deficits were screened for eating problems and sensory profile. And the findings from that study showed significant correlations between sensory processing and eating problems at each SPD level. More, of course, among moderate to severe profound levels. How do we expect um, nutrition to be in those children? As you know, proper nutrition is critical to maximize the brain function and to enhance the process. The nervous system must have essential fats, minerals, B vitamins, fat-soluble antioxidants, and vitamins such as vitamin E, for example. Missing any of those critical components, it creates a weak spot in our immune system. Because nutrients interact, a deficiency in one can affect the utilization of another. So, for example, a low level of vitamin B6 means a poor uptake of zinc and magnesium. Starting with the macronutrients, as you all know, pretty very important to make most of the body tissues, the muscles, the bones. It includes neurotransmitters, which is very important for learning. Neurotransmitters, of course, are the chemical messengers that carry the information from the brain cells to other brain cells. Carbs were found in the grains, fruits, and vegetables, broken down into sugar, which we call the fuel of the fat. Essential fats are the most important nutrients for sensory development. As you know that the brain is 60% fat and myelin is the fatty coating of the neurons or the brain cells. It is 75% fat. The fat composition of the brain directly reflects the dietary fat intake at a basic biochemical level. Sensory integration dysfunction represents immaturity in the nervous system. Bad fats means poor maturation. Fats make up more than 60% of the brain. They act as a messenger in partial control of aspects such as mood. When shelf-stable hydrogenated oils are incorporated into the brain, the tissue becomes less flexible. This means information will be sent and received differently. A balanced brain utilizes a combination of saturated and unsaturated fats from meat, fish, nuts, and grains. For optimal brain function, we have to avoid partially hydrogenated fats. They're found in most of the commercially baked goods, frozen prepared meals, and margarine. Butter is no more saturated than regular margarine, as the hydrogenation process resaturates or hardens the original oil. It is better to use small quantities of butter and more of other oils like olive or sesame. Several oils are sold as dietary supplements. They all contain different combinations of two main families of essential fats like omega 3 and omega 6. Fish, algae, and linseed oils contain predominantly omega-3 fats. Evening primrose, blackcurrant, borage, and sunflower oils have more omega-6 fats. Flaxseed oil is unique because it contains an approximate of 1-to-1 ratio of omega-3 and omega-6 fats. Concerning the micronutrients or the vitamins and minerals, they are important substances for the functions of the brain. The most important vitamins are A, B, C, and E. And of course, nutrients interact, as I previously said, low vitamin B6 levels may lead to decreased uptake of zinc and magnesium. Please refer to the lecture of macronutrients and micronutrients for further clarification of those slides. They found a correlation between magnesium and the degree of hearing loss. So, in a study, they gave magnesium supplements to servicemen, and they found that those supplements prevented nerve damage to their ears from exposure to loud artillery fire. And if servicemen with sufficient magnesium can avoid hearing loss, it may follow that youngsters with good magnesium levels better resist the hearing damage, auditory processing problems, and sensory motor difficulties associated with frequent ear infections. How do we treat such patients? Well, the treatment plan has to be so individualized. We have to focus on multisensory activities designed to help children cope where they struggle and they get used to food and textures. We have to exercise patience and persistence without being forceful. It is very important to have a structured routine. They have to eat at the same time, at the same location, with the same utensils. This can help create a lot of comfort and a primer for mealtime. Parents and siblings should serve as role models and they have to praise children for every single step. Food served should be easy for kids to manage. They have to be cut into small, chewable bites or thin strips to hold. You have to present a child with a total of 3 foods on their plate, roughly 1 tablespoon per each year. So if he's 4 years old, then he has four tablespoonfuls of food in his plate. Encourage the child to play with their food and explore it. Don't panic if they spoil around them. Getting children into the kitchen, participating in meal preparation, setting the table, passing food family style, and cleaning up can also be very. Start by removing the worst. Empty the calorie foods. Remove them from the house and close the nutrient gap with supplements. Provide a balanced biochemical and sensory diet is the best way for parents to engender well-regulated nervous systems in their children. I finished the presentation. I will be happy to answer all your questions in the comments. Thank you very much.